Mr. Kelleher, 5 minutes.
Much Kelleher, and thank you, Minister, and welcome you to the House. A lot of the questions would have been more appropriate for me to address to the Minister who's departed, but if you're not in a position to reply, I would be grateful for something in writing. I want to also acknowledge commitments to dual diagnosis in the statement, and I know that my colleague Senator Francis Black will want more specifics on what those improvements mentioned in the statement look like. But my specific questions are around provisions being made for the 55,000 people with dementia in the 2018 HSE service plan, and what the specific priorities and commitments are. I noticed that the statement was light on detail on dementia. Do they include the expansion of dementia advisors to build a national network? The All-Party Oireachtas Group on Dementia, of which I am co-convener, called for an investment of £1.6 million to go from 8 dementia advisors nationally to 30, and building that year on year. We met with the Minister last week. He said he would be back to us. I still haven't heard. I'd like to know where we stand on that particular call. Also, about the call for £6 million ring-fenced dementia-specific home care. There was mention of home care but not dementia-specific. And also, the All-Party Group asked for money to be set aside for assistive technology innovations, the continuation of the GP Prepared project, and £1 million support for people with Down syndrome and dementia. People get early onset in that group, dementia, and they are not really catered for either in the disability sector or in the dementia or the older people sector. So I would be grateful for some specifics, and if you can't give them, Minister, please write to me. I also want to ask the Minister about proposals for the extension of the home care. I heard this morning that 37 million has been allocated for older people, so that isn't all going to home care, and one of the officials at the Joint Oireachtas Health Committee said 2/3 of that would be for home care. So I'd like to have a transparent figure on what the budget for home care is for 2018 versus what it was for 2017. I also heard this morning at the Joint Oireachtas Committee that it's going to take 2 to 3 years to roll out home care, the statutory scheme and regulation. That is too long to expect the people who are waiting for home care, and there are 195,000 carers to wait. It is just too long, and I would like a greater sense of urgency there. And could the Minister outline progress of his department about adult safeguarding? Since the safeguarding bill passed committee stage, considerable development work is going on, including 2 hearings at the Health Committee, new research from the Institute of Public Administration, also published in October, and newly commissioned research currently underway by UCD. Can the Minister give an update and to note my readiness to work with his officials on this important piece of public policy? Again, I've written, I've offered, I'm doing a lot of work, but I can't talk to myself on this matter. And finally, what provision is the Minister making for tackling the waiting lists in COMH? Minister Byrne, you were here to hear me speak on this matter last year. Some progress is being made, but the lists are still among the highest in the country, and I know that the doctors are looking for 2.7 million to maintain progress for running costs, and I'd like to know where they stand in relation to that figure. Thank you.